CNA Practice Test questions and answers.
The nursing assistant knows that urine is normally
A,
dark in color and foul-smelling,
B,
dark yellow,
C,
clear, dark yellow,
D,
clear, pale yellow. Correct answer, D, clear, pale yellow. Clear, pale yellow urine indicates a well-hydrated patient. The nursing assistant is helping a male patient to use the urinal. She pulls the curtain around the bed for privacy before saying,
A,
"If you do not fill it completely, I will empty it later.
B,
If you need any more assistance, please ring the bell.
C,
Please ring me when you are finished and I will empty it for you.
D,
Please let me know later how many ml." Correct answer, C. Please ring me when you are finished and I will empty it for you. The nursing assistant cannot ask the patient to measure his own urine or delay in emptying it. Once the patient is finished, he should ring the bell so that she can measure it and empty it herself. A patient is undergoing bowel training. The nursing assistant knows that bowel training
A,
is used for people with colostomies to ensure a regular pattern,
B,
is a normal part of a healthy digestive tract,
C,
is a technique for going to the bathroom without pushing,
D,
is not used anymore. Correct answer, A, is used for people with colostomies to ensure a regular pattern. Bowel training is used with ostomy patients to ensure a regular elimination pattern. The nursing assistant would suspect that one of her patients is having a problem with swallowing if she notices which of the following?
A,
Completing a meal over the course of 15 minutes.
B,
Chewing very slowly.
C,
Pocketing of food.
D,
Uneven chewing. Correct answer, C. Pocketing of food. A patient who pockets food may be having a difficult time swallowing. When caring for a patient, the nursing assistant notices that the patient is bleeding around in foresight. Which of the following is the most appropriate action to take?
A,
Clamp the forecatheter and tell the nurse.
B,
Tell the nurse when she happens to see her.
C,
Report it to the patient's nurse immediately.
D,
Report it to the nursing supervisor. Correct answer, C. Report it to the patient's nurse immediately. This should be reported to the patient's nurse immediately. Rectal temperatures are usually taken on patients who are
A,
combative,
B,
unconscious,
C,
anxious,
D, confused.
Correct answer, B. Unconscious. Unconscious patients cannot close their mouths around an oral thermometer. Any of the other patient types would be resistant and/or fearful to a rectal thermometer. A typical blood pressure around the upper arm should not be taken when the patient
A,
complains that this is the 5th time today,
B,
has 4 catheters in both the left and right arms,
C,
has heart failure,
D,
has had lymph nodes removed around the axilla of the left arm. Correct answer, B, has 4 catheters in both the left and right arms. If the patient has 4 catheters in both arms, a blood pressure cuff will impede their intravenous flow. Which of the following is an example of nonverbal communication?
A,
Hand gestures,
B,
a whisper,
C,
mouthing words,
D,
minimizing facial expression. Correct answer, A. Hand gestures. Hand gestures are an example of nonverbal communication. Which of the following is an example of emotional lability?
A,
The patient gets upset after a long day and blames it on tiredness.
B,
The patient gets upset when he learns he has been diagnosed with cancer.
C.
The patient gets upset when he does not receive a plate in his favorite color.
D.
The patient gets upset after telling the nurse immediately prior how happy he is. Correct answer, D. The patient gets upset after telling the nurse immediately prior how happy he is. Switching quickly from happy to sad or mad to peaceful is the definition of emotional lability. The nursing assistant speaks with the nursing facility's ombudsman. The role of this position is to
A.
care for patients as if they were their own family,
B.
make residents as happy as possible,
C.
assist residents to set up insurance and policy claims,
D.
investigate residents' complaints and bring them to the attention of the correct authorities. Correct answer, D. Investigate residents' complaints and bring them to the attention of the correct authorities. The ombudsman's job is to ensure that residents' complaints are heard. An 85-year-old resident at a long-term care facility is signing up for an afternoon activity. The resident asks the nursing assistant which choice she thinks is best. Which of the following should the nursing assistant suggest?
A.
Gardening,
B.
Tai Chi and meditation,
C.
basketball,
D.
watching TV. Correct answer, B. Tai Chi and meditation. Tai Chi is excellent for balance and would help the patient to decrease her risk of falls. Meditation may increase happiness and decrease any depression. Watching TV encourages stasis, not movement, and the rest are perhaps too active. The nursing assistant knows that the term pulse deficit refers to
A.
the difference between the systolic and diastolic blood pressure,
B.
an absence of the pulse,
C.
the difference between the apical and radial pulse,
D.
a strong pulse. Correct answer, C. The difference between the apical and radial pulse. The apical pulse is assessed through a stethoscope placed over the heart, while the radial pulse is typically taken by applying finger pressure to the inner wrist and counting the number of heartbeats. The difference between the two pulse rates is called the pulse deficit. A nursing assistant watches a nurse teach a client about heart failure. The client has many questions and seems more confused rather than less. Which of the following strategies is best in regard to teaching?
A.
Give the client a DVD to watch about heart failure.
B.
Have the client repeat back what the nurse has said.
C.
Give the client a brochure about heart failure.
D.
Encourage the client to form more of a discussion with the nurse in order to understand better. Correct answer, D. Encourage the client to form more of a discussion with the nurse in order to understand better. The more involved a client is in learning, the more they will remember and understand. The nursing assistant cares for a client with AIDS. The nursing assistant knows that AIDS patients require what type of precautions?
A.
Droplet,
B. Contact. C.
respiratory,
D.
standard. Correct answer, D.
Standard.
AIDS patients require standard precautions. Gloves must be worn at all times when handling blood or other body fluids. When the nursing assistant brings the client his tray for lunch, the client repeats questions twice before remembering the answer. The nursing assistant knows that the client had a fall 2 days ago. Which of the following actions is correct?
A.
Assess the client's head for bruising.
B.
Take the client's temperature.
C.
Report it to the nurse immediately.
D.
Assume the client is forgetful. Correct answer, C. Report it to the nurse immediately. Memory loss after a fall can indicate a concussion. Report it to the nurse immediately. A resident is having difficulty chewing regular meals at dinner. Which of the following diets might be suggested to order for next time?
A. Soft. B.
Liquid.
C.
Pureed.
D.
Hard. Correct answer. A.
Soft.
A soft diet should be tried before a pureed diet for this patient. A patient says that her visitor is unable to come during visitor hours and asks if she could be accommodated. The nursing assistant
A.
reviews the issue with the patient's nurse before answering.
B.
Says, "Of course, that would be fine."
C.
Reviews the issue with the charge nurse before answering.
D.
Says, "I'm sorry, that's not our policy here." Correct answer, C. Reviews the issue with the charge nurse before answering. It is appropriate to review this with a charge nurse of the unit before answering yes or no. Before assisting the nurse to administer an enema to a bedridden client, the nursing assistant should most importantly
A.
review the procedure and what's going to happen.
B.
Open the window.
C.
Reassure the client that it won't hurt much.
D.
Gather all materials needed. Correct answer, A. Review the procedure and what's going to happen. It is important for the resident to know what's going to happen and what to expect. When making the patient's bed, the nursing assistant knows it is most important to
A.
change the pillow cover every 4 hours.
B.
Use linen that has only been in the client's room.
C.
Inspect the sheets for softness.
D.
Straighten the sheets to reduce wrinkle formation. Correct answer, D. Straighten the sheets to reduce wrinkle formation. Wrinkles and creases in the sheets can contribute to bed sores. Rehabilitation care after any injury should begin
A.
when the patient enters a rehab program.
B.
1 week into recovery.
C.
As soon as possible.
D.
When the doctor says so. Correct answer, C. As soon as possible. Rehabilitation should begin as soon as possible in order to get the most recovery. A nursing assistant who suspects a resident is being abused by someone in the facility should report it to
A.
the charge nurse,
B.
the nurse caring for the client,
C.
a fellow nurse's aide,
D.
the CEO. Correct answer, A. The charge nurse. Reporting it to the charge nurse will ensure that it is handled properly. A nursing assistant cares for a resident who has a cast on the left arm. While receiving a bed bath, the nursing assistant notices that the fingers on the client's left hand are cold. Which of the following actions should the nursing assistant take next?
A.
Tell the nurse immediately.
B.
Feel the client's fingers on the other hand.
C.
Ask the client if it hurts.
D.
Give the client gloves. Correct answer, B. Feel the client's fingers on the other hand. First, check the fingers on the other hand. The client may have overall decreased circulation. If the fingers on the other hand are warm, however, the cast may need to be adjusted. A client in the hospital announces that he is leaving this minute and that no one can stop him. The nursing assistant should
A.
tell the patient to wait and see if he likes the care more as he feels better.
B.
Tell the patient to wait so that she can get the nurse because he has to sign a form.
C.
Warn the patient that it's better to follow the doctor's recommendations.
D.
Tell the patient that he can't leave. Correct answer, B. Tell the patient to wait so that she can get the nurse because he has to sign a form. Clients who want to leave AMA against medical advice may do so, but they need to sign an AMA form or their insurance will often not pay for treatment. A patient with a respiratory illness complains of thick, sticky secretions that are hard to cough up. The nursing assistant knows to suggest which of the following?
A,
Drink plenty of fluids.
B,
Turn and cough every hour.
C,
Go outside and breathe the fresh air.
D,
Cough harder. Correct answer, A. Drink plenty of fluids. Drinking fluids will help to lubricate the secretions so that the patient can cough them up easier. A patient has a fever and describes feeling very uncomfortable. Which of the following recommendations is best for the nursing assistant to provide?
A,
Give the patient a back rub.
B, administer Tylenol 500 mg PO. C,
Give the patient a cool washcloth to be placed on the forehead.
D,
Suggest the patient sit outside in the fresh air. Correct answer, C. Give the patient a cool washcloth to be placed on the forehead. A cool washcloth can make a patient with a fever feel better. The nursing assistant may not administer medications. The nursing assistant overhears the nurse say to the patient that he has a bulging tympanic membrane. What does this most likely mean?
A,
The patient is in pain.
B,
The patient has a viral illness.
C,
The patient has an ear infection.
D,
The patient should clean his ears more frequently. Correct answer, C. The patient has an ear infection. The tympanic membrane is more commonly known as the eardrum. A bulging, tympanic membrane typically indicates an ear infection, not necessarily a viral illness. A patient who has recently been paralyzed below the waist due to a motorcycle accident refuses his medications from the nurse. The patient then refuses to say anything. What is the nursing assistant's best response?
A,
Say, "You seem upset."
B,
Ignore the client's temper tantrum.
C,
Say, "Why did you refuse your medication?"
D,
Say, "Don't worry, things will seem better tomorrow." Correct answer, A. Say, "You seem upset." Reflective statements are an important therapeutic tool. A 52-year-old homeless man has just been admitted to the ER with a core body temperature of 90.2 degrees Fahrenheit. The doctor diagnoses the man with hypothermia. The nursing assistant knows that the organ most under stress from the low body temperature is the
A,
lungs,
B,
liver,
C,
heart.
D, ears.
Correct answer, C. Heart. The heart may fail or go into an arrhythmia from the drop in body temperature. The nursing assistant receives her assignment for the shift and notices that she does not have a nurse assigned to her group. What action should she take next?
A,
Offer to team up with another nursing assistant to give medications.
B,
Begin gathering medications she must give.
C,
Loudly complain about the situation.
D,
Alert the charge nurse to the situation. Correct answer, D. Alert the charge nurse to the situation. Medications may not be given by a nursing assistant. Alert the charge nurse to ensure that there is a nurse provided for each client in the assignment. A nursing assistant begins caring for a client during a bed bath and notes he has a reddened, intact area on his coccyx. Which of the following correctly describes this condition?
A,
Ulceration stage 1.
B,
Ulceration stage 2.
C,
Ulceration stage 3.
D,
Ulceration stage 4. Correct answer, A. Ulceration stage 1. This is a stage 1 ulceration or bed sore and should be reported to the nurse.